Hi, everybody. Welcome. Chapter 12 on psychological disorders is again one of my favorite chapters because I am a clinical psychologist by training. And so this chapter on disorders is where we see the entire field of psychology coming together as both a science and a practice. And that's what clinical psychologists do. Research psychologists at universities conduct studies and gather knowledge, and then clinical psychologists and psychotherapists use this knowledge in hospitals and clinics to make people's lives better. Today, in our semester, we start the next theme I call When Things Go Wrong, featuring topics on psychological disorders and psychotherapies, our next chapter. In the last few chapters, we've discussed human development and personality formation. So here, we talk about when things don't turn out great, or when people struggle under stress and then develop psychological, emotional, or behavioral problems. Psychological disorders is another complex, fascinating, and long topic, so we're going to spend 2 weeks on this topic. There's so much to say here. I also imagine that this topic is one of the most people considered when first signing up for a class in psychology. So I kind of want to slow down here and take time to be sure to answer all your questions about psychological disorders and then later psychotherapies in the next chapter. Psychological disorders, also known as abnormal psychology, by the way, that's another class that I teach, are experiences of the perfectly normal thoughts, feelings, behaviors, and perceptions just taken to some extreme in intensity and or duration, meaning intense symptoms that last weeks or months and just doesn't go away on its own. You'll see in this chapter abnormal anxiety, for example, that is out of proportion to the situation and lasts weeks and even months. At some point, feeling anxious becomes diagnosable as an anxiety disorder. Feeling sad and down can also go too far, that is, too intensely sad and lasts too long duration, and crosses a line into abnormal. At some point, feeling sad and depressed becomes diagnosable as depression. So in short, abnormal psychology is normal psychology taken to some kind of an extreme in intensity or duration. We actually recognize these thoughts, feelings, and perceptions, anxiety and depression, in their mild forms as part of normal human experience. It is the extremes here that draw the attention of mental health caregivers like psychologists and psychiatrists. Now in this chapter, be sure to watch the videos. Here you'll hear patients who seem like perfectly normal people, but they describe feeling and thinking negative things involuntarily. The truth is, if they could stop the negative thoughts or the feelings, they would. They cannot, and that's why we call it a disorder. There's lots to talk about in this chapter on psychological disorders. Here in part 1, we focus on defining what is abnormal and what is a disorder as distinct and different from everyday experiences. We may have many specific types of disorders to discuss here, but we start with anxiety disorders characterized by frequent fearful thoughts that something terrible might happen to me in the near future. Much and fascinating topics to talk about in this chapter on psychological disorders as we start the next theme of the semester called When Things Go Wrong. I think you're going to find this really interesting. Let's get started.